Hello, everybody. We are bringing another episode of Wednesday Wisdom, but today you get the Jen and Jenny show. So we're going to talk to you all about physical therapy and how you become one, what it is, and kind of what we do every day. So I'm going to start off with talking about what the physical therapy programs entail. So we were thinking maybe about 12 years ago is when it moved from being a master's degree to a doctorate degree. So now we are called doctors. The length of a physical therapy program differs a little bit from school to school, but for the most part, a physical therapy program is 3 years, including summers. When they changed it to the doctorate program, the types of classes that they added for us were differential diagnosis, so we could tell if you needed to go back to a doctor first before we kept treating. Pharmacology, so we could understand your medications and how they might affect your body that way. We learned a lot more about different disease processes, and of course, we learned very extensively about anatomy and physiology. Also, throughout those 3 years, we take clinical rotations, so we go spend time in other clinics and get to follow physical therapists and kind of hone in on our skills a little bit there. And we have to do different types of settings. So you have to do outpatient, inpatient, some then can go into pediatrics rotation, home health rotation, skilled nursing facilities, all kinds of different ones that you can go into. So I think we did 5 in my program.
I know we did like 18 weeks total, or 18 or 20 weeks, something like that. It
something
was extensive.
Like that, at least 6 weeks for the first few, and then I think 8 weeks on our last 2 or something like that. And then even while you're in the program, you're typically doing some kind of PT work too within the program that you're in. So one question we get a lot though is the difference between a doctorate and a PhD. So Jen's going to take over on that question.
So like Jenny said, yes, technically as physical therapists now, if we've graduated with our doctorate degree, yes, we are technically doctors. Some physical therapists do prefer to be called doctor. Other physical therapists do not. Personally for me, I don't really want to be called a doctor. I'm a little bit more informal, more casual. So yes, we have our clinical doctorate degree in physical therapy, not to be confused with a PhD. So we have, both Jenny and I have our DPT degree, not to be confused, like I said, with PhD. So the biggest difference is the clinical doctorate focuses on clinical practice and treating patients. When you are somebody who has gone beyond your DPT degree and has a PhD, that usually has a much heavier emphasis on clinical research. So typically with a PhD, you're in more of an academic setting, teaching in PT programs, working in research labs, publishing papers in journals and things like that, really on the cutting edge of research, trying to find new things and help guide the PT profession. So that is the biggest difference between having your DPT or doctorate of physical therapy versus having a PhD. So we get that question a lot, so hopefully that sort of clears things up for people. But yes, we are technically doctors, but we do have our doctorate of physical therapy. So the biggest push for us becoming doctors was something called direct access. So many years ago, I think like Jenny said, maybe 12 years ago, the APTA, which is the American Physical Therapy Association, the governing body for PTs, had this, they called it Vision 2020. So by the year 2020, which we are in right now, they wanted all PTs to have a doctorate degree to allow for something called direct access. So what direct access is it's something like, when you go see a chiropractor now where you don't have to have a doctor's referral to go see them. The push was for PTs to become direct access, so you wouldn't specifically need a doctor's referral to see a physical therapist. And again, that's why we added in with PT programs these additional classes in differential diagnosis, like Jenny was saying, to really step up our clinical skills as healthcare providers to be able to identify people who really needed to see a medical doctor or who were appropriate to see a physical therapist. So here we are in 2020, and we do have some forms of direct access. So Most insurance companies do not require you to have a physician's referral for direct access. Couple caveats with that is Medicare. So Medicare has been a stickler. They still require you to have a physician's prescription for PT. And then some commercial insurances do as well. But for the most part, a lot of the bigger insurances do not require physician referrals. So that means as someone seeking medical care, you can come directly to us. We can evaluate you, we can diagnose you, and we can determine if it's whatever you're coming to us for, if that's appropriate for us to treat, or if we do need to refer you on to somebody else for a further, more specific evaluation as well. So that's kind of basically the ins and outs of why we are doctors now and how we utilize direct access. And it has been a great thing for the PT profession because now we can see patients much sooner. So when you do have an injury, you don't really have to wait 2, 3, 4 weeks to get in to see a PT. You can get in and basically be seen right away, which is a huge asset when you have a new injury.
Yeah, for sure. So PTs also require a lot of continuing education like most health professionals do. So every 2 years, we have to have 20 continuing education credits, and so that can be upwards of 5 to 10 classes taken online, taken in person, and they can be a variety of different classes from pelvic floor to total knee replacements to running injuries, and so most physical therapists kind of go into whatever they specialize in or something new they want to learn about, but every 2 years we have to turn in our continuing education certification in order to keep our license up to date with the state. Each state is different on their requirements, but that's what it is for us here in Oregon. And then physical therapists do work in a variety of settings, like I said, but we are in an outpatient physical therapy clinic, and even among outpatient physical therapists, every PT has a different style. So we kind of wanted to talk about what our style was here in Resolve Physical Therapy. Jen and I are pretty similar in our styles of treatment. So you'll get some PTs that will be all hands-on, nothing else. You'll get some physical therapists who will do only exercises and never put their hands on you. But here at Resolve, we do a pretty good mixture of therapeutic exercise. So we're going to show you correct stretches and strengthening activities that you can do to fix some of those weak or injured areas. We're going to do some manual therapy, which is when we get our hands on you and try to feel where you have some soft tissue restrictions, where you have some joint restrictions that we need to work on. We're going to manually stretch, your neck or your shoulder or whatever it is we're working on. We're going to massage certain areas where you have some trigger points and such. And then the third part kind of to our treatment style is that we're going to teach you how to move better. I think it's a big part that is missing from a lot of PTs these days. But we're going to teach you how to squat better, how to lift better, how to set your desk up at home, how to sit in your car better. Because if you repetitively do these things wrong, no matter what we show you, you're not going to get better. So we have to teach you to move better first, and then do those other exercises and manual therapy things on top of that to really help. So hopefully that helps kind of clear up a little bit about what physical therapists are and what they do and how we got here.
Absolutely. And like Jenny said too, we get that question a lot of, oh, you're doctors, so there is some confusion with that, so hopefully that is helpful for people to understand the amount of education that we go through, the extensiveness of our training that makes us qualified healthcare professionals.
Absolutely. So thanks for joining us again for another episode of Wednesday Wisdom, and feel free to contact us if you have any questions. Thanks.